Like trends nationwide, new cases of COVID-19 and hospitalizations are declining in Arizona. But the state is far from being in the clear, says Dr. Gerald. He's the Associate Professor of Public Health Policy and Management at the U of A Mellon Enid Zuckerman College of Public Health.
Relatively speaking, we are still trailing everyone else. We're still in a crisis situation. Our hospitals are full. They're not as full as they were, but they're still very full. And so we have another 4 to 6 weeks to go before we're going to be in a much, much better place.
For those vaccinated, Gerald says they should still follow CDC guidelines around mask wearing, frequent hand washing, and social distancing.
Some of that is to model good behaviors because the general public doesn't know who and who hasn't been vaccinated. And there's still many, many Arizonans who are waiting in line and are still susceptible. The other thing is we don't exactly know how well the vaccine does at preventing infections. We know it's doing a great job at preventing severe infections, hospitalizations, and deaths. But that still leaves a little bit of question about whether people could become infected with a very mild case and still transmit to others.
As for whether those vaccinated should still get tested for COVID-19 if they don't feel well, the doctor says it depends.
I think certainly if you have only had one dose, then it's still possible that you could have COVID-19. The first dose only seems to afford about 50% protection. It's not until 2 weeks or more after the second dose in which the 95% efficacy still kicks in. So I think after that point, getting tested would not be necessary unless you're really symptomatic.
Where he sees gaps in distribution concerns who can receive the vaccine.
Those who are minorities, those who are in rural areas, they have been hit harder and have had less access to testing. And so I think it's a real concern that they may struggle to get their fair place in line for vaccination. And so it's something that needs continued attention.